Welcome to our deep dive into effective drug reform strategies. Now, if you're anything like me, the phrase drug reform probably doesn't exactly get your pulse racing. It sounds about as thrilling as watching paint dry, or perhaps slightly less exciting than listening to a TED talk about the structural integrity of beige cardigans. But the truth is, this is an issue that touches all of our lives, whether we realize it or not. For decades, the United States has been stuck in a cycle of failed drug policies. We've thrown billions of dollars and countless lives at a system that simply doesn't work. We've treated drug addiction as a moral failing rather than a public health crisis. And frankly, it's time for a new approach. Today, we're going to explore 8 key strategies that can help us break this cycle and build a more just and effective system. We'll talk about everything from decriminalization and harm reduction to treatment, prevention, and criminal justice reform. So buckle up, folks, because we're about to get into it.
Let's start by addressing the elephant in the room. Or perhaps more accurately, the elephant we've been locking up in increasingly overcrowded sells drug criminalization. Now, I know what you're thinking. Decriminalization? Legalization? Isn't that just going to turn our country into some kind of free-for-all drug den? Well, not exactly. First, it's crucial to understand that decriminalization and legalization are not the same thing. Decriminalization means removing criminal penalties for possession of small amounts of certain drugs, essentially treating drug use as a health issue rather than a criminal one. Legalization, on the other hand, goes a step further by regulating and taxing the production and sale of drugs, much like we do with alcohol and tobacco. The evidence is clear. Countries that have adopted these approaches have seen significant reductions in drug-related deaths, HIV and hepatitis C transmission, and overall drug use. Portugal, for example, decriminalized all drugs in 2001 and has since witnessed a dramatic drop in drug-related problems.
Now let's talk about harm reduction. This approach is all about practicality. It's about acknowledging that people use drugs, and rather than simply telling them to stop, which, let's face it, hasn't been working out so well, we need to provide them with the tools and resources to do so as safely as possible. Think of it like this. We don't try to eliminate car accidents by simply banning cars, do we? No, we have seat belts, airbags, traffic laws, and driver's education. Harm reduction applies this same logic to drug use. This means things like needle exchange programs, which help prevent the spread of HIV and hepatitis C. It means supervised consumption sites, where people can use drugs in a safe and monitored environment, reducing the risk of overdose. And it means expanding access to naloxone, a life-saving medication that can reverse opioid overdoses.
Now, I know some of you might be thinking, okay, but what about getting people off drugs entirely? And that's where treatment and rehabilitation come in. But here's the thing. For far too long, we've treated drug addiction as a moral failing rather than a health issue. We've locked people up instead of getting them the help they need. It's like trying to treat a broken leg with a timeout. We need to expand access to evidence-based treatment programs, including medication-assisted treatment, which has been proven to be highly effective in helping people overcome opioid addiction. We need to invest in long-term support services, such as housing, job training, and mental health care, to help people rebuild their lives. Remember, addiction is a chronic disease, not a character flaw. And like any chronic disease, it requires ongoing care and support.
Chapter 4, Education and Prevention. Knowledge is power. Now, let's talk about prevention. Because let's be honest, wouldn't it be great if we could prevent people from becoming addicted to drugs in the first place? But here's the thing about drug education. Lecturing teenagers about the dangers of drugs while showing them pictures of fried eggs and saying, "This is your brain on drugs," just doesn't cut it. We need to move beyond the scare tactics and just say no campaigns of the past and provide young people with accurate, evidence-based information about drugs and their effects. We need to teach them critical thinking skills so they can make informed decisions about their health and well-being. And perhaps most importantly, we need to create supportive environments that foster healthy choices and provide alternatives to drug use.
Chapter 5. Criminal Justice Reform. rethinking our approach to punishment. Now let's talk about the criminal justice system, because let's be honest, it's not exactly known for its nuanced approach to drug use. For decades, we've been fighting the war on drugs with mandatory minimum sentences, harsh penalties for non-violent drug offenses, and mass incarceration. And the result? Well, we've created the largest prison population in the world, disproportionately impacting communities of color. We need to rethink our entire approach to drug offenses. We need to end mandatory minimum sentences, which take away judges' discretion and often result in excessively long sentences. We need to invest in alternatives to incarceration, such as drug courts, community service, and treatment programs. And we need to address the systemic racism that permeates our criminal justice system.
Now let's talk about mental health, because the truth is, you can't talk about drug addiction without talking about mental health. There's a reason why people say things like hurt people, hurt people. Many people who struggle with addiction also have co-occurring mental health disorders such as depression, anxiety, or PTSD. But here's the problem. Our mental health care system is about as well-funded and accessible as a library in a town run by book-burning zealots. We need to invest in expanding access to mental health care, and I mean real quality care, not just a 5-minute appointment with a therapist who's already got one foot out the door. We need to integrate mental health services into drug treatment programs, and we need to address the stigma surrounding mental illness.
Now, I know what you're thinking. John, this is all well and good, but how do we know what works? Well, that's where research and data come in. We can't just rely on gut feelings or outdated ideologies. We need to base our drug policies on evidence. We need to invest in research into the causes of drug addiction, the effectiveness of various treatment methods, and the impacts of different drug policies. We need to collect data on drug use patterns, overdose rates, and the social and economic costs of addiction. And most importantly, we need to be willing to adjust our approach based on the evidence.
And finally, let's talk about public policy and advocacy, because here's the thing. None of these changes are going to happen unless we demand them. We need to make our voices heard. We need to contact our elected officials and tell them that we support drug policy reform. We need to vote for candidates who prioritize evidence-based solutions over outdated ideologies. We need to challenge the stigma surrounding drug addiction and advocate for those who are struggling. We need to support organizations that are working to change the system. Remember, change doesn't happen overnight. It takes time, it takes effort, and it takes all of us working together. But together, we can create a more just, compassionate, and effective approach to drug policy.
Look, I get it. Talking about drug reform can be messy, it's complex, it's uncomfortable. But here's the thing, we can't afford to shy away from difficult conversations. We can't keep doing the same thing over and over again and expecting different results. By combining these approaches, we can create a more effective and humane drug policy that improves public health and reduces the negative impacts of drug use and drug policies. We can break the cycle of addiction, reduce crime, and build stronger, healthier communities. Thanks for watching, and don't forget to subscribe for more insightful content. And remember, change starts with each and every one of us.